According to the World Health Organization, epilepsy is one of the most common neurological diseases, affecting around 50 million people globally. Today on Medical Matters, we find out more about epilepsy and how it can impact sufferers' lives. The WHO describes epilepsy as a chronic, non-communicable disease of the brain characterized by seizures.
Seizures are excessive electrical discharges in the brains of the neurons or brain cells. Those kinds of discharges produce these symptoms which we call seizures.
Now, epilepsy can start at any age. It may be caused by various things, and in many cases, it is difficult to pinpoint an exact reason.
It can start in adulthood, and it does in many patients start in childhood. Some of the childhood epilepsies are self-limiting and they actually stop after some years, but many of the childhood epilepsies can carry on into adulthood, and people can acquire or can develop seizures during adulthood as well, both of the genetic type and the acquired type. Basically, any type of damage to the brain can cause that excitability of those neurons, which can cause epilepsy.
It's important that those who are living with epilepsy and those around them be able to identify the triggers and signs that an attack is imminent.
The main symptom is having a seizure. There are focal seizures and there are generalized seizures. The generalized seizure that is most well known is the generalized tonic-clonic seizure, where someone loses consciousness, their body goes stiff and starts convulsing, jerking. If they have had 2 seizures or more, then they are diagnosed with epilepsy. There's another type of generalized seizure, which is also a frequent type of symptom, where the patient stares and often isn't present, and because of that, it is called an absence seizure. In focal epilepsy, it depends where in the brain the seizure or these abnormal excitation happens in the brain. For example, if it's in where the motor cortex, you will see a jerking type of movement. The patient may be awake, but it will be one side usually. It could be sensory symptom. It could be behavioral symptoms. So each focal epilepsy is different depending on where the epilepsy or the seizure is located in the brain.
There is no cure for epilepsy, but majority of patients can manage the condition with proper treatment and some other interventions.
The main type of treatment for epilepsy is medication. So the medication basically reduces that excitation, and it does it on a chemical basis. And by reducing the excitation, it reduces the likelihood of a seizure actually happening, because that seizure is that increasing excitation till it reaches a threshold. That medication suppresses that excitation, so the seizure doesn't happen. You also get people who are refractory to treatment of medication, and for those, surgery or invasive treatments can be considered. There's a treatment called vagal nerve stimulation, and there's also epilepsy surgery.
If epileptic seizures aren't managed and happen one after the other, the consequences could be devastating. If you have epilepsy, it's vital that you let those around you know. And if you know someone with epilepsy, it's equally important that you know exactly what to do in case of a seizure.
So if someone has an epileptic attack around you, the best thing to do is to ensure the safety of the person during an epileptic seizure. So you would want to put them in a recovery position, which is placing them on their side and allow them to have the seizure, not to place anything within their mouth, and to time them. If the seizure goes beyond 5 minutes, then to call an ambulance.
No doubt, having epilepsy can really affect someone's quality of life. It can affect your mental health, your learning ability, other functions like driving, and can also impact your performance at work. A person with long-term epilepsy may experience many of these challenges and might need daily assistance. But many patients can and do go on to live normal lives if epilepsy is diagnosed early and treated accurately.